Hey, I'm Nick Katkovich from Providence. Yeah, I just want to start off, to like folks from the Department of Health, just so you all know, a couple weeks ago, the governor, Gina Raimondo was sitting right there. And when she was sitting there, she said that if there are any issues with this power plant, then it shouldn't be built. So I think it's up. So that's, your boss in a way saying that she wants to know the truth about this power plant. So I hope y'all do your job, after hearing all these great comments from everyone tonight, and do a deeper analysis on the health impacts of this project. I just want to, add on to what folks have already been saying about the MTBE water. One thing, of course, if not all the MTBE gets cleaned out of it by the time it reaches the power plant, and a lot of that air will evaporate. I forgot how many hundreds of thousands of gallons of water is going to evaporate. I think, your health assessment didn't mention the impacts of airborne MTBE. The Delaware Health and Social Services Department released a study about airborne MTBE. I can just read like a paragraph quote from that. It says, animal studies of airborne MTBE showed nervous system problems as the most common effect. For about an hour, the animals acted drunk. They became less active, fell down, and had partly closed eyes. Some rats and mice died, and some had nose and throat irritation. Long-term problems were less weight gain, kidney disease, cancer, and enlarged livers. There were birth defects in some of the young. So I think the impacts of airborne MTBE need to be added to the analysis. Also, of course, MTBE leaking from the water source and the other water supplies. I think your report did talk a lot about like the sound and the noise, but I feel there could have been some stronger language about, if this sound can't be mitigated, the noise can't be mitigated, and it poses a health risk, then this project shouldn't be built, having some more harder conclusions. And I know the town's experts, when they're talking about noise, it'll be nearly impossible. Take some monumental engineering feat for Invenergy to meet the noise standards that they put in their application. The other thing that I think could be added to the assessment, during construction of the proposed power plant, I can't remember the exact number, I can submit it later on, it's between 3,000 and 4,000 heavy-duty 18-wheeler trucks will be coming up Route 44 into Burrillville. Most of those trucks will run on diesel fuel, so what's the impact going to be of thousands of trucks getting stuck? And if you all know the roads in Greenville and everything coming up here, there's a lot of lights, there's a lot of traffic, so what's the impact of thousands of idling diesel fuel trucks in a downtown area? The DEM, when, there's so many filings and reports, but the DEM I can't remember where it was, I know it was with the Energy Facility Citing Board, they talked about how the cumulative impacts of all the projects being built up here, need to be analyzed together, holistically. Invenergy, when they first proposed the project in the Providence Journal, they said that this project is going to be connected to the expanded Spectra pipeline as part of a project known as Access Northeast. Access Northeast is also going to expand the compressor station in Burrillville, the Spectra's compressor station. So those two projects should be viewed as one project because our friends from Invenergy said that's the case. So I hope that the Department of Health takes their word for it. There's also, the other power plant in Burrillville, the other compressor station, and I think the impacts of all these need to be calculated together with Invenergy's proposed project. In terms of climate change, I mentioned this at another hearing. In Pakistan this year, villagers were preemptively digging mass graves in preparation for the thousands of people that are going to die from climate change. Okay? And this is a real serious health threat to our whole civilization and to people around the world. And I would just really implore the Department of Health to find the courage to really speak up and really say the facts that if this project is built, it's going to hurt public health. There's no other way around that. And I'll just really implore y'all to have the courage to say that. If you can look at the New York Department of Health, the state of New York banned fracking a couple years ago. The reason was, the governor said if this is bad for health, we shouldn't frack. They did a big health study and they said that it's bad for health, so now fracking was banned in the state of New York. So there's a precedent for that. As just like a couple more asks, I would encourage the health department to either push the DEM or push for your own air modeling to be done up here. I'm not sure if you're solely going on Invenergy's records, but I think independent air modeling would be really good. And I think a project of this size and this impact, particularly with the MTBE water, calls for a full health impact assessment, not just an advisory opinion. So I'll just request that the Department of Health, make that clear that a project that could potentially have so many devastating impacts, should require a full independent health risk assessment. Thank you.